frankly, it's a cause for celebration. Today I'll present an overview of the new changes, then we'll have a discussion with our guest panel, and then we'll take some questions from the audience. I recall back in January, I was still very ambivalent about what was coming out of Congress. I know a number of you were as well. Some of you still may be. There's no public option, the pace of implementation is slow, it doesn't insure everybody, it's very complicated, yada, yada, yada. And all that's true. But the more I've learned about the new health law, the more excited I am about it. And if you're not already excited about the Affordable Care Act, I'm hoping you'll leave that way today. And nothing gets people more excited than semantics. So when we talk about the new health law, we're actually referring to two different pieces of legislation. The Patient Protection and Affordable Care Act, the Health Care and Education Reconciliation Act, or for short, the Affordable Care Act, or ACA, the new health law. So let's recall why something had to be done about our broken healthcare system. There are around 4 million uninsured Floridians. Between 2000 and 2009, average premiums for families in Florida increased by 88%. Florida businesses and families already pay a hidden tax of $1,400 a year on premiums because of the costs providing care to uninsured Floridians. In 2007, the percentage of Floridians with employer-based coverage dropped to 54%. In 2006, only 39% of Florida small businesses offered coverage. And some of you probably heard, according to the new census, 51 million Americans are now uninsured. So as I said, this is an historic day, and I'm going to discuss the changes that are taking effect. It's important to keep this in mind. These changes I'm going to talk about apply to plan years that begin after today. Some of these apply to all plans, and some of them apply to new plans only. Job-based health plans and new individual plans won't be allowed to deny or exclude your children under 19 based on a pre-existing condition or a disability. Starting today, if you have children under age 26, you can generally insure them if your policy allows for dependent coverage. They don't even have to live at home. The only exception is that if you have an existing job-based plan and your children can get their own job-based coverage. Starting today, insurance companies will be prohibited from canceling your insurance just because you get sick. They can't impose lifetime dollar limits on essential coverage, and there are now restrictions on annual coverage limits. Today, new health plans must cover certain preventive services without any additional cost to the insuree. And women no longer need a referral to see an OB/GYN. If a new insurance plan doesn't pay for services you think were covered, there are now new options for you to appeal. There are internal and external appeals processes, and we can get into those later in the discussion. If you have a medical emergency, as I said, you no longer have to ask your insurance company permission to go to a hospital out of your network or pay more for doing so. And lastly, you're now free to choose a pediatrician to serve as your child's primary care physician.